Thank you, Dr. Alex, for joining us on the first episode of AHPI Digital Health podcast series. So, recently you published a book on the future of healthcare transforming with technologies. So, why don't we start our episode with discussing about that book? So, what inspired you to write that book, and what key messages you want to convey to the healthcare professional through this book?
Thank you for having me. It's nice to be here. Now, this book is more than a few years old, and the reason I actually thought of writing it was at that time many clinicians and healthcare workers felt very threatened, and there was very little knowledge about technology among the healthcare workers, and there was a lack of desire to acquire knowledge about the technology because basically they felt insecure and threatened. They thought it's going to take over our jobs, but that is not true. So the key message that was through, and I mean, here I just got all the eminent people to write, and the key message was to encourage the use of technology, and also that this is the first step in embracing technology, and also to
Right.
tell them that embracing technology is no longer optional. It is
Yeah.
actually essential for, and we are there for patients, and this is essential for improving patient outcomes and also operational efficiency. And mainly to highlight the fact that all of us, healthcare professionals, nurses, doctors, must recognize that these tools can enhance their practice and facilitate better patient engagement and ultimately better patient outcomes.
That's very true, Dr. Alex. And at the end, every technology is there to enhance your or save the time and efforts you are putting, right? And thus providing the better outcome to the end users or the customer of the services. Now, you have been in healthcare industry since past 30, 40 years, right? And recently, all the digital technologies are becoming a facet in the healthcare industry, providing care to the remotest area in the India or the whole world, right? So if you could share a couple of examples in your journey where you have seen digital technologies transforming how healthcare industry is improving the patient care in India or the globally.
Yes, I think it is actually transformed in many ways. I'll start off with an example where we were closely involved. Now, AHPI has a partner called 5C Radiology. So
Mhm.
this young man came to us many years ago. We researched him and then we decided to take him on as a partner. Today, he's the largest radiology aggregator in the country.
Oh, wow.
And he has made a change. And what are the changes? I think earlier to get a radiologist to report an X-ray or a CT scan, probably 3 or 4 days it used to take. Today there's a
Yeah.
turnaround time of 40 minutes. The
Wow.
accuracy of reporting, he has a three-level mechanism of checking, so that the reports are about 98%. And recently they've started using AI, and that is actually see, radiologists don't like to report X-rays and all the normal X-rays. So that has been taken over and with a high degree of accuracy. So that is one that has really helped transform healthcare because reports come in time, they are accurate. I'm not saying radios are not accurate, but delay also is a factor in bad outcomes. And this has definitely helped improve outcomes. Other areas, we have all seen the implementation of the electronic health records. So this
Yeah.
will streamline patient data, and wherever the patient goes, it will lead to more coordinated care. And I think every day we see a mobile health application getting traction, allowing patients also to monitor their own conditions and diabetes to real-time tracking, and this ultimately helps in better health. And a lot of AI-driven diagnostic tools makes clinicians make quicker and more accurate diagnosis. Actually,
True.
in my case, when I was a practicing orthopedic surgeon, we used to do rounds in the morning, we used to do rounds in the afternoon, and at sick patients, we used to go do rounds at night. Now that is no longer necessary because we get the actual progress as it happens.
Right.
And we can go spend more time bonding with the patient. Looking at nursing, I think another engaging and a very exciting event is this technology monitored by AI. We are
Mhm.
associated with a few companies there, And to date, we have found that they are a little more accurate, because in many parts of the country, I'm not putting any aspersions on nurses. Some of the nurses are very badly trained, and they really don't take the vitals as required. So here with AI,
Right.
it is monitored, and they're also able to predict any disasters. And more
True.
importantly, the nurse can spend more time bonding with the patient, talking to the patient, which is a very important part of the healing process. So I think it's
Right.
there are a lot of. I've just given you a few examples, but yes, technology is actually transforming healthcare. The use of technology.
Great. So you spoke about telemedicine and remote patient monitoring, right? How nurses use the remote patient monitoring tools to provide enhanced care. Now, recently, and this is written in your book as well, that India's telemedicine market is going to grow by 30% by 2025. So, what do you think? What could be the role of telemedicine and remote patient monitoring in rural India, specifically where the larger healthcare hospitals or the specialty treatments is not possible to reach. So, what do you think about the reach of telemedicine and RPM in the rural India?
I think they're going to make a big difference. I'm only a little disappointed that it hasn't actually taken off as expected, but it will, because it's a good thing.
Right.
One is they bridge the gap between urban healthcare facilities and rural patients who otherwise face a lot of barriers to access. They ensure timely consultation. Very importantly, reduce travel costs, and this helps the environment side.
Right.
And continuous monitoring of chronic diseases are happening. What is happening today is that our focus was to get telemedicine and remote monitoring for rural India, but a
Hmm.
lot of people from outside the country find find it much more convenient and cheaper to do telemedicine with our
In
doctors in the country. But I think we need to focus on this, because telemedicine and remote monitoring. I was at robotic surgery conference the other day, and it is amazing.
hmm.
The best surgical expertise can be given to the place which is farthest from India, with the surgeon sitting in Delhi with somebody there. I think it'll transform medicine. You get the best. The best clinical opinions and the best clinical expertise. And I think governments and the AHPI is doing a lot in this. I'll come to that later. To see that through telemedicine and remote monitoring, there are very powerful tools in ensuring universal healthcare for all our patients.
Right. That's a great way to say universal healthcare for all, right? Not just India, but the whole world. So,
Yes.
we talked about how telemedicine, RPM, or these digital health technologies can enhance the patient care. Now, what do you think? What are the key challenges healthcare providers or the doctor face when they want to implement this digital health solution, and how can they overcome these barriers?
I think it's education, education, and education. See, most of India's healthcare is in the smaller two-tier, three-tier cities, where the facilities run by husband, wife, or the family. And for
Right.
some reason, they are very, very scared to adopt technology. One
Mhm.
of the reasons, and I'm being frank, is that a lot of cash transactions take place. The government is recognizing and told us this. But I think it's important for us to show them data, show them studies which show that with this, their revenue will actually double or triple.
Right.
So there is a big, big barrier. And some of the barriers are actually government induced. One big barrier is the PCP&DT Act. Now,
Mhm.
because of the PCP&DT Act, I'm just giving you an example. Uh, every ultrasound machine, you have to tell you where it is, what it is used, and there's a huge. Many people don't do it because any ultrasound, any part of the body is governed by the PCP&DT Act. So
Mhm.
probably if, if that act is changed, probably we will have the number of ultrasoundologists in the country will probably who are practicing will probably go tenfold. And ultrasound is a very, very important and a very cost-effective and high quality point of care device. So I think that is one. We are working with the government. We are trying to tell them that you let PCP and DTP only for the gynecology and relax it for the others. I think it will be a huge change. Just if you only change the PCT Act and allow doctors all over the country to freely use ultrasound. Using technology, ultrasound can be done at the most remotest corner of the country with somebody sitting in a metro, and that will add great value. So I think these are the two major issues that we're focusing on at the minute, at the present time.
Great. So, if we talk about AHPI, right, and being one of the largest association of healthcare provider in India, having more than 20,000 hospitals joined with it, what are the what as a AHPI you are doing to increase the adoption of digital health technology, be it EHR, EMR, be it remote monitoring devices, be it telemedicine, what AHPI is doing to increase this adoption in the member hospitals?
Yeah, so one of the first things we did was write this book, and it's available free to everybody.
Yeah.
The print copy is available in Amazon, but all our books, and especially this book, because it's a vast repertoire of knowledge, we made it available to anybody in the country who wants to use it. We provide a lot of resources and training also. In fact, the national NHA, the digital mission, we are I think one of the only partners, and we have held meetings all over the country to try and promote hospitals to join the NHA, join the National Digital Health Mission, talking to them about the advantages, etc. We also work with NABH, and you may have heard of the 𝗃𝗏 Foundation.
Yeah.
𝗵𝗶𝗴𝗵𝗏 𝗃𝗏 is, I think, a man on a mission. He's a chairman of NABH, but he's a man on a mission even before that to try and spread digital literacy out all across the country. So we have worked with him. In fact, he used this my book to actually come up with his digital. He has a digital course course on this. So he used my book. We actually collaborate with them, and we have held digital master classes for CEOs in various parts of the country. And we also, as I said earlier, we partner with startups in technology. We have tied up with 5C. We work with Walter Clovers, and Dr. Rajendra Gupta, who's actually having a global digital summit. We partner with him, and I think very importantly, we are probably the only NGO which has partnered with ISRO. Use their technology. We've come up with standards for accident and emergency centers. And now we are actually working with ISRO to use technology to try and come up with hospitals and centers in different parts of the country where blood banks are available, where accident and emergency, what are the services available, etc.
Okay. So as a part of AHPI, I recently went to the AHPI's website, and there is a whole online training academy of the AHPI as well, right? So that is increasing the knowledge about, so basically trainings of quality professionals in India. Apart from this, I have seen AHPI working closely with NHA in implementing ABDM as well, and ABDM being one of the prime program of Government of India to transform the digital health in India. So what in your personal capacity as well as AHPI is doing to increase the awareness of ABDM and overall digital health, government implementation of digital health in India?
Yeah, I think we have I forgot to mention a very important thing that AHPI is doing. We have a digital vertical. We have 4 or 5 verticals. One is in scientific, one is in climate change, and this. So we have a separate vertical on digital, and they're doing a lot of work. With regard to ABDM, we have, I think, had 3 or 4 meetings in different parts of the country where we're promoting use of this. And we have a monthly chapter meeting of all our 21 chapters. So we have actually been encouraging them to collaborate with the government. There are some issues about security, etc. So we have talked to the government also, conveying their concerns to the government. But I think at the end of the day, it is very important that looking at it from the patient point of view, that all this come under one roof. And I think the government is the best person to be a custodian of this, at the same time ensuring that the patient's data is kept confidential. And we feel that having this central body will definitely be useful for the patients, because we have the data. They can go anywhere in the country and there's transparency.
Great. Now, so that is what I have been observing, that ABDM can be an UPI of healthcare, right?
Yes,
UPI transform the whole financial uh, infrastructure of
absolutely.
India, and ABDM could be that. So now, looking at this past work of AHPI and your experience in healthcare, what do you think? What could be the next trend or innovation in healthcare in next 5 to 10 years?
I think that artificial intelligence and machine learning is going to play a significant role in the future of healthcare. See, these technologies will also help us enhance predictive analysis, which is very important. Predictive analytics. We always say prevention is better than cure.
Right.
So I think this is an important meeting. It will also help us in clinical decision making and standardization. And now I think every other person has. I mean, all of us wear these watches, right? So
Watches.
wearable health technology will help us, will enable continuous monitoring and proactive. I think proactive management is very important. So it's not that when you have a heart attack, what can you do to prevent a heart attack? So it will
Yeah.
shift the focus from reactive to preventive, and that will play a huge role in the health of the population. We'll spend less on curative medicine. Our population will become more productive, and India as a nation will actually progress very rapidly. The other area which I'm seeing, which is gaining a lot of ground, is robotic surgery and robotic ultrasound. As I said
Mhm.
earlier, you have the best surgical expertise available at the tip of your fingers, literally, for anybody anywhere. And at this robotic conference, I was saying that through the robo you can do an ultrasound. So wherever the
Oh,
patient is. But again, here we have to sort out the PCP&D Act. So that's why we are now focusing on that. It may appear very small, may appear only for the gynecologists, but that's not true. It affects the entire health sector.
got it. So this is very enhanced. Like this is something. This whole episode will help everyone to understand what AHPI is doing in the digital health. Now, at the end of this podcast, what advice would you give to healthcare professional and institution who is looking to adopt the digital health technology and to improve the patient care?
My advice would be that sometimes we are very closed. So to my colleagues and to hospital administrators, approach digital transformation with an open mind and always be willing to learn. So have an open mind and a willingness to learn. I think the first thing that an individual or an institution can do is start by identifying specific needs in your particular organization, pain points within your organization. And I think it's important to seek feedback from both staff and patients for all these pain points. Then collaborate with the technology experts. Invest in training, it's very important. Invest in training all your staff to ensure that everybody is equipped to use these tools effectively. And I think finally, you have to embrace a culture of innovation where there will be mistakes. Trial and error are seen as opportunities for growth rather than setbacks. So I think we need to understand that technology will never ever replace the healthcare, but it will help greatly in achieving a lot of things. And at the end of the day, I think technology will be a game changer, and it will help our healthcare professionals to ensure that all of us in our country and beyond our borders, we can go. The first step is within our country, that we get universal healthcare for all our citizens.
Definitely. And that is one of the key problem in India in healthcare is doctor to patient ratio, right? Every doctor is burdened today. And if doctors or institutions starts looking digital health technologies as a mean to improve their life, improve their work-life balance, then probably it is not us versus them. It is a collaboration between digital health and doctors or nurses or the healthcare professional. So, thank you, Dr. Alex, for being on the
My
first
pleasure.
episode of AHPI's Digital Health Podcast. We thank you very much for this.
Thank you. Thank you for the opportunity.